Hi, Steve.
Oh,
Hi, Stephen. We're about to start.
good.
Good morning, ladies and gentlemen. Thank you for joining us at this event by the Baker Institute this morning. My name is Tony Payan. I'm the director of the Center for the United States and Mexico at Rice University's Baker Institute for Public Policy. Today, we convene here with you to show off one of our works of this year. This book in particular, it's called Binational Commons, Institutional Development and Governance on the U.S. Mexico Border. 2 years ago, we convened at the Baker Institute, and we wanted to have a workshop to discuss various issues affecting the U.S. Mexico border. Over the course of those conversations, we ended up discussing the state of institutions and governance. And at the end of the day, we decided that it was time to do a thorough review of the institutions that provide the guidelines for governance on various issues and topics that pertain to the US-Mexico border, especially because we were in the midst of a very controversial administration, the Donald Trump administration, that had made the US-Mexico border one of the most important political footballs of the administration. There have been several events to present different chapters of this important book. I think a unique book in what it addresses collectively. And today we have 4 of the authors that I'm going to introduce to you, and we're going to hear from them for about 10 or 12 minutes, and then we will entertain your questions. One of the authors is Kimberly Collins. Kimberly Collins is the executive director of the Barbara and William Leonard Transportation Center at California State University in San Bernardino. She is a professor of public administration at that university and a faculty liaison for the CLA-DEA, the Latin American Commission for Administration Schools. Collins' current research focuses on social equality, sustainability networks, and democracy in communities, particularly in the borderlands. And of course, she is an expert on the issue of cross-border infrastructure on the US-Mexico border, and the chapter pertains to that very subject. We also have among us Eva Moya, a colleague, former colleague, because she's at the University of Texas at El Paso, where I spent 14 years as a professor in the political science department. Eva Moya is the associate professor at the Department of Social Work at the University of Texas at El Paso. She received a master's in social work from the University of Texas at Austin and a PhD in health sciences from the University of Texas at El Paso. And Eva deals with the issues of cooperation and the entire institutional scaffolding on the issue of public health, and she'll talk to us about that. And we also have a dean of studies of the US-Mexico border, Stephen Mummy. He's a professor of political science at Colorado State University and an affiliated faculty member at the School of Global Environmental Sustainability. If I know somebody who has actually made a school and formed a lot of human capital on the issue of environmental as well as natural resource management on the US-Mexico border, on those watersheds that straddle both sides of the US-Mexico border, it's going to be Stephen Mummy, and he'll talk to us about that. So it's a pleasure to have him here. He co-authored his chapter with Dr. Iracema Coronado, who was the executive secretary at the CCE and now director of the School of Transborder Studies and ASU. And at the end, I think we'll hear from Octavio Rodriguez Ferreira, who is from Aguascalientes, Mexico. In fact, he's there right now visiting his family. He's a researcher and the executive director of the Justice in Mexico Project, a research and policy program at the University of San Diego in San Diego, California, where I actually met him a few times. And so it's a pleasure to have him here. and he will address the issue of the institutions for on-the-ground collaboration and security. Although the topics that we're going to address today are very different: natural resources and the environment, public health, infrastructure, and security, rest assured that what lies at the bottom of all these different subjects is that we address head-on the state of the institutional scaffolding that provides governance and the venues for both countries to make sense of the issues that they share along the border and the way they deal with them. So without much further ado, let me ask Kimberly Collins, who is one of our first speaker. She will then cue in Stephen, and then Eva and Octavio will go last. So Kimberly, the floor is yours. Welcome to this forum on the presentation of our book. Thank you.
Thank you very much, Tony, for the invitation to speak today and to be with you. I have just one slide that I would like to put forward in thinking about transportation institutions along the U.S. Mexican border. Transportation, of course, is one of those key policy issues that always seems to be at the forefront of discussion. How do we maintain a clear line of travel, be it commerce or people, across the border? As we all know, the connections and the linkages between the North American supply chain is very strong. There were some issues, of course, with COVID and a response by both governments to really try and maintain those supply chains open and business moving. So this is just a map. It's actually not in my chapter because it's not a great quality to print, but it shows these connections between the United States and Mexico, particularly thinking about the highway connections and where goods move from Mexico into the United States and vice versa. Part of the institutions to make sure that this transportation continues are seen in the border master plans. Each state or region has a master plan. The first state to put it forward was California, Baja California, or the joint states. And that master plan really led off looking at how to create those connections at the federal and state level and maintain them so that we can have some vision of what our border crossings will be like and what the infrastructure will have. There was a second plan, of course, done in California, Baja California, and currently there is a planning process that is underway for the California, Baja California border region. And as these plans have moved forward, they've really begun to enrich the institution of transportation. It's allowed for stakeholder engagement. You have business voices, you have individuals who are able to comment. I currently sit on the California, Baja California stakeholder group, so we're able to provide input and thought on how these plans should come about and thinking about transportation for the future within the region itself. Of course, there's also plans in Arizona, Sonora, and there's two plans for the New Mexico, El Paso, Juarez, and then the Lower Rio Grande region within Texas. A lot of these planning processes, of course, are set within the policies or processes of the federal and state governments. And each of the state governments, of course, handle transportation in a different way. So thinking about transportation and infrastructure and the funding that goes behind it. All of these are part of the formal and informal institutional structure of transportation along the border. Additionally, we have the methods of collaboration, which really leads to this idea of governance within the transportation sector. A lot of them are based on these principles, as we talk about in the public administration field, of new public management. So the ideas of shared governance between the federal, state, and local governments. Now, as you can imagine, there are, of course, different structures, again, within the states. So each state might have, a COG, a Council of Governments, or a Metropolitan Planning Organization, and these regional governance issues, as well as as well as the local county or state or city governments that might be there. So there's a difference that happens along the states of how this regional governance works in as well. And Texas works very different than California in many ways when it looks at regional governance, particularly thinking of how rural the border is along the Texas border. I mean, there are some central cities, but it's really much more of a rural area than the California border, which is a shorter border, of course, and has a large metropolitan zone as San Diego. So this governance approach, it leads to some consistency in the planning process, but also some differences within these institutional frameworks. Of course, they're all based upon this idea of you know, the USMCA today, NAFTA in the past. So we have these large binational agreements or trinational agreements that help to move trade. The movement of people, of course, is a bit different. And so thinking about transportation for the future is really based in these ideas of security paradigms that exist along the region. How do we maintain the security and the safety within the border crossings, within the border zone, but make sure that we can start thinking about the new technologies and the new opportunities that are existing within the transportation sector. So if we start thinking about alternative fuels, which in California is a very large conversation, currently the state has put forward that by 2035, we will not be selling any more gas combustion vehicles. It's going to be a purely electric fleet or a you know, it will be using hydrogen fuel cells. So really thinking about, you know, zero emission vehicles. So how is that going to play out in the border? Right now, it's not quite clear how that infrastructure is going to occur. There's also, because many of the trucks, I'm sure you've all seen, and I know this is a bit outside of the border conversation, but relates to the infrastructure and the institutions that are needed. Many of the trucks now are working towards hydrogen or full electric vehicles. How are those going to be charged? How are they going to work across the border? There's a range and there's all types of fueling stations. So there's the freight side, but there's also, of course, the transportation side of individuals. And we start thinking about the movements within transportation and the ideas of how you make, you know, a multimodal solution for people to be able to cross the border and be able to visit on the other side. As many of you probably know, the border has not been completely shut down, but has been slowed down quite a bit with COVID. And many of these opportunities for people to cross have subsided in many ways. And so if right now it's difficult for Mexican citizens or Mexican passport holders to come across the border unless they can really prove there's an essential reason. For the U.S. side, U.S. are able to cross, but the borders borders and protection and customs have really slowed down many of the crossings. There were waits of up to 10 hours, 12 hours within the San Diego region. The Calexico side with Calexico, Imperial Valley, Mexicali, which is the eastern side of the California border, they have put up sanitary inspection sections on the Mexican side to stop the U.S. from crossing, from U.S. residents from crossing, and that has put waits up to 8 hours within Calexico to try and get across. So right now we're at a different time in thinking about the institutions, and I think what COVID has provided for us in many ways is a look into, we think that we have the border master plans, we have USMCA, we have NAFTA, but how weak some of these linkages are and how they need to be made more robust and really thought about to increase the connections between the countries and using the border as, again, that gateway to allow for the flow of people and commerce. It's been a bit tenuous with COVID and with the shutdown of the border for many of the communities, many of the businesses that are reliant upon the Mexican shopper are having, a very difficult time now. There's been a call to release some of the prohibitions that have occurred along the border, but there's not quite that political will. And there's always this issue of security being at the forefront. So how, again, do we make sure that we can think about transportation as a way to increase the relationships, increase the connections between the countries, make sure that those institutions are strong. So when a crisis does occur, we are able to get through it quickly, not have these long conversations of what's essential, what's not essential, and be able to maintain those connections that are so important for the businesses and the residents, the 14 million or so people who live along the border and really rely upon those open crossings to be able to do their everyday lives, to be able to work and visit and have medical attention and do everything that they need to do within their lives. So it's an important part, again, of our structure, of our shared governance between the United States and Mexico. It is based on many formal and informal institutions that I go through in my chapter. Don't talk so much about the COVID piece, but I have another piece that I've written that talks more specifically of the impacts on transportation and COVID. And it's a way for us, again, to really think about how we can improve the system, increase the connections, using new technologies and being prepared for the 21st century. So moving towards a governance system that allows for these new technologies to be embraced and used and implemented along the border, as they will be in many of the states on both sides of the border. With that, Tony, I will wrap it up. And if there's any questions, I'd be happy to respond.
Thank you, Kimberly. Stephen, please go ahead.
Well, thank you, Tony, and it's a nice opportunity to talk about the contributions in Binational Commons, which I think is an important book, and will go a long ways towards educating any number of people who don't normally pay attention to the border about the many challenges that we have there today. I want to thank Iracema Coronado for contributing to this piece. Iracema is taking care of a ailing family member today in Tempe, Arizona, and sends her regrets for not being able to be here. So the piece that Iracema and I wrote was entitled "Environmental Governance Along the U.S. Mexican Border," with the colon and clause attached, institutions at risk. And the institutions at risk part, I think, really sets the stage for what we had to say. I'm going to provide just a brief description of the arc of things, looking at our border environmental institutions. And then I thought I would want to talk about just to pinpoint some of the recommendations that we reached, because I think those are important for the audience to hear today. We looked basically not at environmental problems per se, but at the institutions that have come to populate the U.S. Mexican border that specifically have something to do or a mandate related to binational cooperation along in environmental management along the U.S. Mexican border. And there are 6 institutions that we talk about: the International Boundary and Water Commission, the North American Development Bank and its partner, the Border Environmental Cooperation Commission, that's recently been folded into it, and then the Border Health Commission, the Trilateral Commission for Environmental Cooperation, the Paz Programs, and I'll explain that in a bit, and the Trilateral Committee on Wildlife and Ecosystem Conservation. And so those are six specific institutions that we have that are focused on different aspects of environmental management along the U.S. Mexican border. the arc of things is really rather interesting. If we go back to the late 1970s, mid-late 1970s, we see a gradual accrual of environmental capacity along the U.S. Mexican border, particularly vested in the International Boundary and Water Commission, then following up with the La Paz Programs in 1983, the La Paz Agreement on border environmental cooperation, and then really spiking with the North American Free Trade Agreement, with discussions that began in 1991 and culminated in the trade agreement and the actual agreement in late 1993, and then went into effect in 1994, and then the institutions coming online in the mid 1990s, and so we see this arc of growing capacity for environmental cooperation that really peaks out, I would argue, at about 2002. About 2002, and then what we see since then is a gradual erosion or depletion of environmental capacity that has affected the border and weakened some of these institutions as they have proceeded. And that is our concern, and that's where the institutions at risk comes in. That's what we're looking at now. I'm going to just very briefly talk about these different institutions. If we start with the International Boundary and Water Commission, that's one of the brighter stories in the whole arc that we're looking at, and I want to come back to that, but just noting that we've actually seen some fairly positive gains in recent years through the extraordinary work of the International Boundary and Water Commission and the foreign ministries of the two countries. And so that's looking at the management of our transboundary rivers, and in particular along the U.S. Mexican border, particularly the named rivers in the 1944 water agreement. So that's been good news, but IBWC has really been the most solidly institutionalized body that we have, again with a narrow mandate to deal with just water and to some degree water and sanitation issues and pollution issues along the U.S. Mexican border. It is now 75 years old. It's grounded in treaty, has a really strong institutional basis, the strongest of all the institutions that we have along the U.S. Mexican border. The North American Development Bank was created out of NAFTA. It came into being the Border Environmental Cooperation Commission, North American Development Bank. And it was funded, I think, fairly decently in the mid-late 1990s and through the early 2000s. It had subsidy money through the EPA that was then plowed into a number of important works along the U.S. Mexican border, particularly in the area of water, potable water provision and sanitation, etc. More recently, however, we've seen the North American Development Bank merging its institution. Really, what's kind of happened in this area of financing environmental infrastructure along the U.S. Mexican border through the bank is the kind of consolidation of functions, but in a context of less federal support. And so we've seen sort of declines in the amount of federal subsidies that support much of the work of the North American Development Bank in the last 15 years or so. And recently we got just a little boost last year, $25 million going into North American Development Bank, but as the Good Neighbor Environmental Board has been plaintively noticing for the last decade or so, the amount of money that is directly invested in border sanitation projects in a subsidy form has declined again until last year. It had declined nearly 90%. So that's a factor. The Border Health Commission is a very sad story, et cetera. It really had a lot of potential. Has during the Trump administration really been decimated and practically discontinued. Although that's a little bit of an exaggeration. It exists in paper format and in an office in Avenida Reforma in the U.S. Embassy, but this is one of the I think one of the very aspirational programs along the border that was designed to really bring together the health community to deal with a wide range of health threats, including environmental health problems along the U.S. Mexican border, and it is really taken an enormous hit recently. The Commission for Environmental Cooperation is one of the success stories out of NAFTA. But the problem with that, and by the way, it has been retained under the USMCA agreement last year, and that's good news. But it has just been systematically starved of funds, and that's a problem. It has had no increase in its funding, and there's still no commitments to increasing its funding. It has still in the same $9 million that it was funded, $3 million from each country. That was committed way back when in 1993 and 1994. The Paz Programs, which came out of the Paz Agreement, really began online with going into a more of a planning and integrated binational effort. Those programs really got off the ground with NAFTA in 1991, 1992, and they've been sustained ever since. But the amount of money, again, going into the La Paz programs in the current iteration, Border 2020, which was initiated in the fall of 2012, the amount of money is also not increased. It remains about $2.5 million a year, contributed in I think mostly through the U.S. EPA, but with support from Mexico as well for certain projects, and all of that processed through the North American Development Bank. The Trilateral Committee on Wildlife is another interesting case, which is basically an agreement, a memorandum of understanding between Mexico, Canada, and the United States to cooperate in a wide range of functions, whether it's law enforcement, whether it's focusing on species conservation, et cetera. And these programs really launched more energetically in the mid-1990s after the North American Free Trade Agreement was enacted. The problem with the Trilateral Committee is that it's really pulled back from its border programs. And this is one area that's taken a huge hit from the border wall and the infrastructure building along the U.S. Mexican border. Fish and Wildlife Service can't talk about it because that would be to challenge the dictates of the U.S. government. But the fact is that they've had to back away from programs that they invested years and years in developing along the U.S. Mexican border. We take the Sonoran Pronghorn Antelope Protection Plan, for example, along the Arizona, California, Sonora, Baja California border. So just one example. So these programs have, I think. The good news is that they're sustained. They're still there. We still have them. These, especially the newer programs, the value added that came with the North American Free Trade Agreement. The bad news is that they've just taken a hit, and that they have suffered, I think, a real financial retreat And in some cases, like the Border Health Commission, exist in practically name only these days, which is too bad. At precisely the time, and Eva and I have written about this, and we've written about this recently, basically deploring the fact that precisely at the time we really need this kind of networking, this mobilization of health resources along the border. We don't have it. We have a treaty. We have an agreement, but we don't have the boots on the ground. We don't have the medical community being organized the way it should along the U.S. Mexican border. So at any rate, we're recommending that we're sort of applauding the IBWC for what it's done with recently on the Colorado River, the Tijuana River, and just 2 weeks ago as an update on the Rio Grande River, reaching an agreement in minute 325, dealing with the water debt issue on the Rio Grande River. But we really want it to strengthen its watershed approaches. It's been building up to that. It's been moving in that direction. We'd really like to see more of that. We think that the groundwater's long been neglected along the U.S.-Mexican border. We think that we need a framework agreement. The IBWC has been doing framework agreements, which I think is a very, very good thing. It's basically agreements to agree that creates the groundwork for moving forward and dealing with specific problems along the border. We would like to see that happen. Obviously, with the North American Development Bank, we want to see more funding. We want to see more subsidies that are plowed into specific solutions along the border. That needs to happen. The good news is with the USMCA, they got a promise in that agreement to the authorization for $300 million to be spent. Thus far, only $25 million have actually been appropriated through the U.S. Congress to that end. And so we'll have to see how that rolls out. But it does need more funding. It does need more support, and it also needs to really rethink its public participation mechanisms, which have taken a hit, I think, in recent years as things have consolidated in the 2000s and more recently with the merger of the BEC and the North American Development Bank. Paz programs just need more funding. They need more investment. They need to be strengthened. The Trilateral Committee needs to really ramp up its specific focus on the U.S. Mexican border. That has eroded recently, obviously taking a huge hit. The conservation problems are now enormous as a result of the border wall. That will take perhaps a generation to solve, even if the wall was taken down. And so we have some very serious problems here if we're going to try and conserve species in our natural endowment along and across the U.S. Mexican border, and so that's what we recommended. We also really wanted to address one specific issue that people have talked about for a long time, still isn't being addressed, and that is the fact that we don't deal systematically with the environment along the U.S. Mexican border. We don't have a strategic plan for dealing with the environment along the border. We don't even have a strategic plan for dealing with sanitation issues along the U.S. Mexican border. Why is that? After all these years, that we cannot come to that level of understanding of the dynamics of our border and the urbanization issues and the impacts of trade and development along the U.S. Mexican border. We absolutely need to move in that direction, and of course the recent administration has not done anything to address that. But in fairness, neither did the Obama administration, and neither did earlier administration. So we really need to we have huge challenges, and we really need to look squarely at those challenges and try and meet those challenges going forward. And I'll stop there, Tony. I know I've probably gone over time-wise.
Thank you, Stephen. Very insightful. Eva, please.
Yes, well, first of all, thank you so much, Dr. Payan, for the invitation. I want to acknowledge my colleague, Dr. Silvia Chavez-Baray and Miriam Monroy, who are the contributors of a chapter titled Health Institutions at the U.S.-Mexico Border. And I'm going to use the word La Frontera from this point on to speak about the U.S.-Mexico border region. So I am really thrilled that we published this book, but there's a part of me that says, okay, we need to start working on part 2 of the book, given that the infrastructure that is associated with healthcare has been greatly impacted by the erosion of both systems, by how COVID-19 has challenged systems, has called on the delivery of healthcare. It has really, again, put special pressure on both the US and Mexico to do what needs to be done. This chapter focuses on 4 core principles and says, without effective communication between the two countries at all levels, federal, state, county, municipality, in terms of the healthcare system, we just don't work collectively. Without adequate cooperation, which is critical to addressing especially, infectious conditions, but also chronic conditions, nothing moves. Without adequate investment of capital, which is a region that has been underfunded for the longest, one that has prime data to show that there's been constant structural violence realities, and without adequate collaboration, we're just not going to be able to address the health and human service challenges that we have. So those are the 4 core principles that we cite in this chapter. Again, keep in mind that La Frontera is the largest human mobility area between any 2 nations. So talk about mobility, both in terms of legal and undocumented mobility, transportation, the trade of goods. This is where that great mobility challenge takes place. We continue to have unique demographic, social and cultural, economic, and policy forces that influence the way that people's health behave. And certainly, we were not necessarily on the map as a region until pretty much the IBWC and then later NAFTA that put us on the stage and the center stage in terms of trade. But today, we certainly continue to be sort of like an epicenter of significant large deportations, primarily unauthorized migrants and immigrants, as well as children. Plus, on top of that, a region that produces social, health, and economic, unfortunately, inequalities. And so this come together to really impact people's health. So this chapter, what we done is that we highlight some of the most significant health problems that have been documented. So for example, we spent some quality time looking at the leading causes of death, the leading causes of disease that, by the way, if we were to move the border or that line that unites the 2 countries, diabetes, hypertension, cholesterol issues really pretty much look the same. You wouldn't be able to tell which side is the US and which side is Mexico. What changes is the type of infrastructure and the investments that we have in place. We highlight the challenges associated with the population growth. We are in a region where in about 20 more years from now, we're gonna actually double the population. As a region that doesn't have adequate water, does not have the adequate infrastructure, does not have the sufficient health and human service workforce to be able to address the needs. And then the other big reality that we cite in the chapter is that we are a region that primarily crosses borders for healthcare. Given COVID, there has been significant restrictions. So therefore families have been separated and healthcare is not as accessible and available as it used to be. We were a region where traditionally, if you could cross to Mexico to get your goods, your pharmaceutical, your surgical needs, your dental care, your eye care, your glasses, you would be able to do that. With the spikes in violence, primarily in Mexico, that got stopped to a certain degree. As things settled, people continue to sort of like move. There's a section in the chapter about medical tourism and the expectations and also the possibilities. But now with COVID and the fact that the borders have been pretty much sort of like restricted to basic crossings, I'm of the impression that people are having a harder time getting access to their common medical goods and needs. And so if you're uninsured, which is a major reality that we cite in the chapter on the US side, then your chances are very much limited. And with COVID, we have even more restrictions. So the other thing that we discussed in the chapter, we give you an overview of the healthcare systems of the US and the Mexican side. And that in itself could be another book because, as you know, in the US, we don't have universal healthcare. The closest we have is the Affordable Care Act. And so we talk about sort of like the industry of medical care and how it is primarily available to some, but not all. And when you look at the data for the U.S. Mexico border region, we have about anywhere between a third or greater of populations on the U.S. border counties as being uninsured or underinsured. When we were getting ready to publish this book, we were actually giving significant credit to Seguro Popular, which is the equivalent of a universal healthcare on the Mexican side. But we had to sort of like ask our colleagues, the publisher, to allow us to do one additional change to the chapter. Just because as the book was being published, the Seguro Popular was pretty much scrapped from the Mexican healthcare policy and replaced with the Instituto de Salud para el Bienestar, translated as the Health Institute for Wellbeing. And so in paper, it has interesting promise. I am told that in reality, the challenges are huge. This morning, I was reading and catching up on COVID, and basically the headlines are that the state of Chihuahua, as well as many other states in Mexico, are pretty much closing hospitals because they don't have the hospital beds, they don't have the healthcare workers to continue to see patients that are being impacted with COVID. So my sister city in Juarez is pretty much at capacity. And so individuals in Juarez are having to be moved to the international bridge. Ambulances on the US side are picking up patients on the Mexican, on the international border and bringing them over so that they can get some medical care. So if we were to do a second part of this book, I think the health institution chapter would look even a little bit different and even much more challenging. So we focus in this chapter on the opportunity of where the two systems meet. And the systems meet when we have crisis, when we have outbreaks, when we have a need to collaborate and cooperate. And we also speak about the history of the institutions. And if we have a little bit more time, which we don't, so what I'm going to try to do is just highlight the areas that this chapter focuses on. So we give credit to the history, which basically starts with the Pan American Health Organization, and then sort of like moves into the U.S. Mexico Border Health Association, and then sort of like stops when the evaluations of the Pan American Health Organization and the U.S. Mexico Border Health Commission determined that both the field office of the Pan American Health Organization is no longer needed, which by the way is the only field office outside really of the Pan American Health Organization. That was the field office in El Paso. And so that office closes. Very soon after that, the U.S. Mexico Border Health Association, which had been, in my opinion, probably the most prevalent organization to convene professionals, paraprofessionals, and leaders on both sides along and across the border region, and which had organized by national health councils, pretty much dissolves, leaving the U.S. Mexico border or La Frontera basically with the U.S. Mexico Border Health Commission. And my colleague, Steve already reiterated that the commission had incredible hopes. There's so many people that worked back in the 80s and the 90s to ensure that the adequate legislation that created the commission was to be this institution that would really represent the interests of the region and that would make the border a prime area, not only for health, but to development, an area that would bring together collaboration and cooperation experiences. And in principle, and I would say that the first probably 5 years of the commission, we saw evidence of how that could actually be taking place. But sure enough, the US section of the commission has been pretty much paralyzed. And it's very unfortunate because now more than ever, we need the mission of the commission to stand, which is to be able to really exercise leadership in health that would bring together the 10 states, the professionals, the federal, state, the border health offices, and the equivalent in the Mexican side to be able to address the priorities. So in this chapter, we also highlight what the Healthy People 2020, which now is moving into 2030 priorities are. And they're primarily chronic and degenerative diseases, infectious diseases, injury prevention, maternal and child health, and mental health conditions. So these are the areas where the two governments have agreed that they're going to work together. And I am told that they also agree that they're going to invest, but I'm still waiting to see where the investment is and how is that translating actually into development and support. And then we sort of like highlight, again, the cross-border health access insurance. We talked about medical tourism. And we also highlight a very important contribution that I think the border has made to public health on both countries, which is the presence of community health workers, promotores, promotoras, and indigenous communities that have representatives as well, like CHRs, community health representatives, And they've been at the forefront, and this is certainly a workforce element that is a prime example of how communities take stake of their health and they do what needs to get done. Then we prepared a table, which is an interesting table. In this book, reference the U.S. Mexico Border Health Programs. And we spent some quality time doing some detective work. So we give credit to the federal agencies on the U.S. side and on the Mexican side that have an investment in La Frontera. So because there are many other names out there, they claim they work in the border and they support the border, but when you have to go back into the trenches and see what their operation is or their investment, they're not necessarily there. So in this table, you're going to find some of the federal agencies, including their contact information and their functions and what sectors actually they work in. You're going to find the offices of border health for the US side, and you're going to find the equivalent in Mexico, which are the oficinas de alcance that are funded by the Mexico section of the commission. We give credit to the departments of public health on the 10 states. And then we also cite some of the salient binational initiatives, such as the work in the area of tuberculosis or early warning, infectious disease and surveillance, which I haven't seen very prominently lately. So I'm not sure what they're up to, but I trust that they're still quite active and hopefully they get the adequate investments in place. So we end with citing some policy recommendations, and we don't have enough time, so I'm just gonna highlight a few of the areas that I think are very prevalent. So we're in an intense area of globalization, medical tourism, an area where we see the most xenophobia, health and environmental risk, interesting discussions about security of the homeland, climate change, and urbanization. Now more than ever, we say the two countries that have what it takes need to come back together and agree, disagree, but more importantly, create a strategic direction. There's really no strategic agenda outside of Healthy People 2020, 2030, which are primarily disease-oriented priorities. They quantified morbidity and mortality. There's really no agenda for prevention. That needs to take place. It needs to be built with borderlanders in mind, and it needs to be able to be agreed upon and adequately funded. We need to also be able to document the trends associated with migration and the public health threats, but at the same time, the incredible opportunities that we have as a region to document the resilience and the protective factors that are really at the forefront of how many immigrants and migrants are sort of like moving through this region. Now more than ever, we need to be able to address the major global hot zones. There's some emerging and neglected infectious conditions. COVID, I think, is an incredible opportunity for the region to exercise leadership, to be able to address the economic effects, to address the social isolation. Families have been separated by restrictions in terms of crossing. We need to be able to really come together to share the wealth and the resources and the talents. And we also need to make sure that we invest in adequate workforce because it's very clear that we don't have the workforce that it takes. We have the talent, but we need to make sure that we recruit, we train, and we retain, and we place, and we invest in people's health. And with that, I'm going to stop and turn it over to Octavio.
Thank you, Eva. Octavio?
Thank you very much, Eva, Tony, for this opportunity to speak today. And what an interesting moment to talk about this. It seems like everything was planned to happen like this when we're hours or days where a lot of things can change, especially in the area that I study and that I write about in this chapter, which is security, binational security. But after studying the challenges of security to both countries for a while now, I've been wanting to write this chapter on focusing more on the actual security, on the institutions and both legal and informal, and the frameworks that exist in the binational context to address the challenges instead of focusing on the actual challenges. So this chapter pretty much starts with an overview of the binational security cooperation, both historically and contextually. And the main points or the main argument of my chapter is identifying the different layers of cooperation mechanisms that exist in the U.S. Mexico border in the U.S. Mexico context. I start, for example, developing a three-layered scope, three-layer analysis of the different mechanisms that exist. One being the national level collaboration agreements, which is the first layer and one that requires the agreement of the highest levels of government, the presidents and Congresses from both countries agreeing to macro agreements. And we're talking about, for example, the extradition treaty, the mutual legal assistance in criminal matters treaty, the merit initiative. I talk a little more in deep about the merit initiative here, and other relevant international frameworks, such as some of them that are not exclusively bilateral, but also multilateral, such as the Hague Convention on Child Abduction, and others that composes kind of legal and institutional framework to collaborate at the macro. The second layer of mechanisms are what I call the field level interagency cooperation. This type of cooperation the first layer of cooperation. And so we can see that the actual processes of extradition or foreign prosecution units that respond to initial agreements by both governments are actually one of the best examples of cooperation in the field cooperation. We see, for example, that in mostly in California, but also in Texas, there are special units dedicated to actually enforce some of these treaties, and they have day-to-day collaboration with the Mexican counterparts. Especially, as I mentioned, in cases under Article 4 of the Federal Criminal Code in Mexico that allows Mexico to prosecute transnational criminals that are in Mexican soil, and also child abduction cases. Cases of minors that are abducted in the US and bring to Mexico. And so that's one of the biggest examples of day-to-day collaboration between agencies in Mexico and the US. And the last layer is what I call the on-the-ground informal networks. And that's been a topic that's been fascinating me for a while now, because rather than being something institutionalized and to have an actual legal framework, there are organic. They generate based on confidence and based on this type of day-to-day collaboration between agents in the field. And so after a while of being working together and developing some sort of confidence, they start to generate the sort of organic network that allows them to communicate more easily and to collaborate, trying to navigate through the complicated kind of maze of institutions and laws in both countries, and that are actually at least in the anecdotal evidence that I have, been working for a while now in the border context. One example one example of this effort to somehow institutionalize came with the border liaison mechanism that allowed institutions from both sides of the border to name liaisons to have a more fluent communication between them. And this still be this is a current institution. A lot of agencies in both sides of the border still have their liaisons, and that sort of informal institution seems to be working so far. But what are the main challenges of this type of institutions? They're based in confidence. right? So confidence is not something that can be built in one day or 1 month. So it needs to be a constant collaboration between institutions. And that, of course, it's a problem in the Mexican side more than in the US side because of rotation of personnel. We know that there are no solid career mechanisms in law enforcement institutions in the Mexican side. And because of that, people tend to change when administrations or when local governments change. So sometimes what happens is like a good solid network that has been working quite well now faces the challenge of a new liaison coming. And so, you know, the network's pretty much broken and has to be built again. So those are the types of challenges that this type of mechanisms face in you know, day-to-day basis. Some of the recommendations I make is, of course, you know, trying you know, keep the institutional collaboration in the field with more trainings, more intelligence sharing, especially funding for units such as California and Texas for foreign prosecutions. Actually can help other states that are not on the border to navigate some of the complicated legal caveats of the Mexican system and the other way around. And lastly, as long as both governments keep looking for this field agency collaboration, those informal networks can be can generate. Of course, there's nothing governments can do to generate those types of informal networks, but as long as they keep their relationship and their you know, institutional collaboration, this type of networks can generate organically. Now, some challenges that I didn't cover in the book, but it's what's happening right now, and that might change some of the landscape of how both countries collaborate. And so one of the main challenges is the initial hands-off approach of the Trump administration regarding Mexico. We knew that there was priorities for the US, immigration, the Remain in Mexico program. And you know, that initial approach kind of allowed Mexico to have a much more involved agenda or have a more important role in defining its own security agenda. That initial hands-off approach of the Trump administration seemed to have changed over the last year, with some major arrests and investigation of prominent Mexican figures, such as General Cienfuegos, recently apprehended in LA. And I'm going to talk a little bit more about that in a little bit later. But a second challenge that I identify is, you know, there seemed to be a rapport between López Obrador and Trump, and it seems like López Obrador is willing to play along with the U.S. immigration agenda, as long as there is carte blanche for the López Obrador administration and other issues, for example, energy, trade, and others. So, you know, this kind of hands-off approach of the Trump administration allowed Mexico to have a little more, as I said, carte blanche and other issues. That can change, of course. The Cienfuegos investigation, the Cienfuegos arrest later last month, suggests the lack of confidence from the Trump administration and López Obrador administration, because it appears, and López Obrador has said that his administration, he was never informed of any sort of investigation and action against a top-level cabinet member from last administration, such as General Cienfuegos. So that can significantly change the way both countries are collaborating. what is clear now is the Lopez Obrador administration has mentioned that it's going to review, for example, the how the U.S. enforcement agencies will operate in Mexico and with Mexican counterparts, especially DEA. And so it's not going to be a surprise that following the elections, there is a significant change from the Mexican part and how they're willing to continue the security collaboration with the U.S. And another big challenge, of course, and we're all talking about this in our different fields, is COVID, the COVID-19 pandemic, and that brings problems on safety and sanitary protocols for deportations or the asylum seekers that have to remain in Mexico waiting for their processes in the U.S. And so there is no clear protocols on both sides of the border. And as we have seen with our my colleagues that have presented before me, the lack of capacity on the Mexican side to respond to the pandemic is actually a huge concern on on the security side because of the specific points that I just made. And finally, we can there is still a chance that the U.S. That Mexico has to start negotiating a new agenda with the new administration. There is still that chance, and if there is a Biden administration, everything. If we assume that a Biden administration will continue a little bit of what the Obama administration did in terms of security collaboration, then we're going to see a U.S. government much more interested in security issues, in the role of Mexico in the security collaboration, which can be good for addressing these big challenges that we had. And also we might see a U.S. administration that is less complacent with other AMLO's policies in other fields, so that can also influence the way the AMLO administration is going to be willing to start this new, if it happens, this new bilateral security agenda with a new administration. I think I'm gonna stop right there. I know we're right at the hour. So Tony, please, thank you very much for the time.
Yeah, thank you, Octavio. I don't think we have any time for questions. We've run through the hour very quickly. So unless the audience has a very pressing question, all I have to say is there are 12 chapters to this book. It deals with many different issues. I think one of the most unique chapters in the book is the issue of energy, the untold story of energy trading between the two countries, where Mexico now fully depends on energy supply from the United States, particularly gasoline, but also natural gas that fuels manufacturing in Mexico. And as you can see, what there is today is a border of many speeds. And each of these different issues, 10, 12 different issues the book deals with, are all moving at different speeds. They have different levels of development in terms of their institutions of governance. They have different degrees of cooperation. They have different actors cooperating. And there really is no coordinating mechanism, no coordinating commission between the two countries to look at all these different issues and try to coordinate all these efforts on many, many different fields. So without much more ado, I really congratulate all of you. I think it's a fantastic book. I encourage our audience to buy it. I think you'll enjoy the reading. I certainly have enjoyed our workshops, piecing it together. And I thank you all, and we'll see you in the next event, and hopefully maybe at the ABS sometime soon. So thank you, everyone, and have a good day. Bye-bye.
Thank you, Tony.
Thanks all.
Bye-bye.
Thank you all.